first panel, we've got thanks ever so much. We have divided our guests into 3 panels. The first one on injuries, types and severity of injury. Second one on e-scooter design and user behaviour. And the third one, a more sort of general session about learning from other countries and other studies around the UK, and try to put it in a little bit of context of micromobility and its role in decarbonisation, and that wider picture, and where now, as Margaret said, it's probably going to be a year before any legislation comes into effect. But what should that legislation look like? We've called for a more thorough consultation, more information, more research. But what are your thoughts, or the thoughts of the experts on where it all leads to? So if I could introduce our first panel. If you'd like to reveal yourselves, please. Ed Carlton and Tom Roberts, David Bodansky and Luke Griggs. Fantastic. And just to prove we have the real thing. So if I can just quickly introduce people. Ed, very nice to see you. We've corresponded, emailed and so forth. Very nice to see you. Very nice to see all of you. Ed's a consultant in emergency medicine at North Bristol Trust. And published a 4-week study based on Bristol casualties, and I'm sure you'll talk more about that. And that got a lot of pickup in the interim report we published back in September. Tom Roberts, a doctoral fellow from the Royal College of Emergency Medicine, who's also conducted a study, and I'm sure you'll talk about that. David Bodansky, who's joining us from Canada. So very grateful to you, because I think it's the middle of the night or something, isn't it? Some ungodly hour for you.
7:30, but yes.
Oh, it's not so bad. Okay, thank you. And David's an orthopaedic surgeon from Sunnybrook Hospital, Toronto, I believe, and you've been conducting a study based in casualties in Liverpool. And Luke Griggs, chief exec of Headway, starred on BBC Southeast on Monday or Tuesday, and an excellent report they did on the whole issue. And Headway is a charity providing support for people with serious injuries. So you're seeing another dimension of all this. So could I just sort of start with a question to Ed? When you carried out this study in Bristol, would you like to sort of explain a bit more about the types of the patients you're seeing, the injuries you're seeing, and perhaps how that was different to other traffic injuries?
Yeah, so I think it's worth saying the Bristol study was a really initial exploratory analysis of this issue, and we undertook that in summer of last year, so 2021. And what we were really trying to understand was the impact of the rental schemes, because we'd subjectively seen a large number of people presenting to emergency departments across the city with injuries as a result of falling off rental scooters. And what we found in Bristol, and it was across 3 hospitals, was that essentially we saw, I think it was around 90 injuries in a month, some of which were significant head injuries, but the vast majority were upper limb fractures, I think 40%. And interestingly, the inner city emergency department, which is the Bristol Royal Infirmary, was by far impacted more than the trust where I work, which is slightly away from where the rental schemes have. So we got this hint that there was a big impact from that study, and actually we've since superseded that with Tom's help and extended an evaluation across 20 emergency departments from across the UK. And what we did was essentially a snapshot. So we ran that for a month across these 20 sites to really understand and boil down what the injuries were we were seeing across these emergency departments. And so we, by doing that study, we were then able to get some more data on private e-scooters. And what we started off with when we analysed the data was this hypothesis that private e-scooters go faster, they're unregulated, and they're potentially ridden more on pavement. So would we see more severe injuries from private e-scooters? And although we got some really nice data that showed that there were a high number of injuries from both types, both private and rental. There wasn't really a hint in the data that we could say that private e-scooters were more dangerous. So I think the headlines are that e-scooters, whether they're rental or private, are impacting upon injuries attending the emergency department. The majority of those are minor injuries, but we are seeing life-changing injuries from both forms of e-scooters. And there is a substantial cost to the NHS from this, and I think that shouldn't be underestimated. We also know that those who are injured invariably aren't wearing helmets, and there's a very high level, around 30% of alcohol intoxication seen within those. So that's the sort of headline data. I'm sure Tom will help me boil down more if there are questions on specific injury patterns, but I'd welcome any questions or comments from the panel.
Ed, thanks so much. Margaret is going to try and pick up questions in the chat and put those in. But I mean, it seems an appropriate place to ask Tom to come in and see what you can add to what Ed's just said.
Yeah, sorry, my headphones have just died. My Bluetooth headphones. I hope the sound's okay. So in our national study, we had 250 patients that presented over the month period, which was kind of October, November. So not the height of kind of rental or private e-scooter use because of the weather. And it was particularly rainy that month. But of those 250 patients, there were 300 injuries. The pattern of injuries is consistent with previous data that's been published. So what we're seeing is the most commonly injured part of the body is the upper extremity. So that's the arms, and then the legs, and then it's the face and the head. So you've got about 40% of participants injuring their upper and lower limbs, and then you've got about 20% injuring their face and their head. And that is potentially kind of consistent with a lot of the data around the mechanism of injuries and this notion that they're potentially a little bit more unstable and how they're slightly different to people using bicycles. The vast majority of injuries are what we define as minor injuries, but that doesn't mean to say they're not significant for the patient in terms of these minor injuries would still be fractures, which mean people can't work, which potentially have sort of what we call morbidity, so consequences months and years down to the line. So there are injuries. There is a small proportion that are significant and life-changing. The vast majority are minor, but as Ed sort of pointed to, the cost to the NHS may well be significant, and the cost to the patient and society may well be significant. But it's important to put this into context. So the data we have, we don't have the number of e-scooters. Put that into context, which is important. This data is valuable and it's what we call prospective. So we were collecting these patients as they came in. So this data is sort of quite reliable, but despite doing that, we still had about 30% of cases where we didn't know what type of e-scooter was being driven. So we know private e-scooters were driven in sort of 30%, but there's still another 30% where we don't know what type of scooter. So the data is limited in that regard. So essentially this points to some consistent data around injury patterns, things like helmet use, only 6% were wearing helmets, a high rate of alcohol use, so about 20% as Ed pointed out. But it also points to the fact that the data collection needs to improve around this to actually get consistent trends. So we couldn't properly do kind of our statistical modelling that we wanted to because the amount of unknown data. A final point just on pedestrians. So we did collect that data. So only 4% of participants, injured patients were pedestrians, so slightly lower than previous data. So that's just of note. And yeah, that's about it. So there is a lot of data, and hopefully some of it's in the PACTS report, and we will be publishing soon as well. So more data will come.
Tom, thanks very much. And can you just say, sort of, overall, do you think there have been more patients presenting than would otherwise have been? I mean, obviously, if some people are switching from other modes, there's possibility that those casualties are not occurring. Is it possible to put any perspective on it like that?
I think it's really difficult to say. Essentially, this is a snapshot of 1 month, and anecdotally, the reason we did this was because more patients were presenting with e-scooter injuries. But I can't say confidently whether these people would have been cyclists or not, or whether they would have been previous car users or pedestrians. So that's our problem with this sort of research, is you can only say what the problem is now, and it's not comparative to a previous our previous piece of work. So what, I guess, to look at that problem or look at that question, you have to then look at people that are injured and then ask them specifically, how would you have previously travelled? Have you ever had any previous injuries? So it takes a lot more, there's a lot more work to be done to explore that, but it's almost a different research question, which again takes a whole different approach. Rather than just collecting data on injuries, you'd have to probably interview the participants and understand that a little bit better.
Okay. Tom, thanks so much. I think logically, if we go to David now, and the study that you carried out, and any other sort of perspective on what's been said.
Sure. So thank you very much for asking me to speak. So I think the work that colleagues have done in Bristol has been really interesting, and also the snapshot across the UK. We did work in Liverpool over a 7-month period, prospectively again, so looking forward in time in Liverpool. Now that, as one of the trial centres, was very important because all of the hospitals in Liverpool feed into one network, and you can therefore hopefully pick up all the injuries, which can be one of the Achilles heels of a study like this. We found a couple of points. We worked with one of the rental scooter companies, and they gave us all their data, which allowed us to get hold of the number of kilometres travelled. And we saw during the first 7 months, if I just go to my data, a total of 1.7 million kilometres ridden and 36 injuries, which gives us an injury rate. That injury rate, which goes back to Margaret's original point, is useful because we can then start comparing how many injuries we get on e-scooters compared to other modalities, for example, bicycles. The Department of Transport gave us their data on the number of bicycle miles travelled, and there's complexity in about how that's calculated. And we published that paper for all of you to read if you would like on Friday that's just gone, and the link's in the chat. The other thing that we've been able to do from that is then generate a heat map of where the injuries occur. Liverpool is an inner city area, which is one of the trial sites, and the breakdown of where the scooter rides from a rental perspective occur is in that paper, and you can see that it tends to occur in the downtown area, which is where like the business district, and the rental scooter injuries that are seen are mapped quite closely to that. But importantly, the private scooter use, which we've also seen and logged, happens in other areas. Now that might be, and we've thought about reasons for that, which are either as that they are not limited with geo fencing as to where they can go, and also because people are riding them in places which should be legal, even if e-scooter use was legalized. So there's a different use, a different pattern of behaviour, and we've also mapped out like when these are being used. You might think that people are getting injured when it is foul weather, when it's slippy, there are small wheels, but that's not been the case. This has been a fair weather phenomenon. So it's nice weather outside, people want to come out and play, go out and socialise, people go out and use these things, and we see a corresponding sweep and curve. One last point, which I'll leave you with, and then I'll hand back to David, is that if you look in the paper which we published, you'll see a graph which maps the number of rental use uptake and the number of injury use uptake, and they are very closely correlated. You might say, well, surely they should start diverging as public health interventions, for example, safety campaigns, because there was a poster campaign in Liverpool, or helmet use would also start taking an impact on that. But unfortunately, it's still very closely correlated, which implies, but doesn't give absolute data, that these are still not taking an effect and are not yet sticky. We, as orthopaedic surgical teams, have only looked at the orthopaedic injuries because that's what we see. And the question that we often get asked is, what was the helmet use? Anecdotally, very low, to answer one of the questions from Anna Barber in the chat. Thank you.
David, that's fantastic. I think we look forward to that paper. But just very quickly, you talked about rates, casualty rates, and I think you sort of said that you've looked at bicycle casualty rates as well. And I mean, can you just give us a snapshot on what that shows, if anything?
Sure. So if we the problem is that if we look at a small snapshot, then our numbers are low, and so therefore our picture can be a little bit distorted. But as we get more information, this will come in time as e-scooter information and data becomes more widely available, our knowledge and understanding will be better. at the moment, looking at the data that we got out of Liverpool, and I'll point you again to that paper because it'll give you, it's in all the detail how we got there. The injury rate, so number of injuries per kilometre travelled, works out at 26.1, which is high. And again, Liverpool is an inner city area where which is known for its deprivation in some metrics. And in comparison, the same in an overlapping period of time, because we can't get it exactly, in 2020, the injury rate for bicycles for 7 million kilometres travelled is 24. So it's a little bit higher, and the injury pattern is a little bit different. But you do have people who are presenting with life-changing injuries and very significant injuries. Just to answer Adriana's question that's come through in the chat, the injuries that we've defined as severe and also minor are on the same metric, which is the Stats 19 system used by the police, and which are reported to the police. We're working with the Department of Transport, City Council in Liverpool, and also the police partners. And the challenge is that if you are on an illegal scooter, and perhaps David will have a comment on this, people do not stop in order to give insurance details. If you're on a rental scooter, the rental scooter schemes, as I understand it, are insured, and therefore they will stop because they'll want to integrate their insurance through the scooter insurance system. So there's a paucity or data of insurance for the private scooters, which is better, but still not complete for the rental scooters.
David, that's fantastic. I think some of those points, some of our later panelists, Sergeant Steve Wilson or Catherine from Wakeman's, may be able to answer better than me. But I'm conscious we're sort of when it comes to Luke, because Luke, you're picking up head injury cases obviously after they've been through the health service. And can you give us your perspective?
Yeah. So Headway is the UK's leading brain injury charity, and we support people and try to help people to rebuild their lives, relearn lost skills, and regain a degree of independence after suffering from life-changing brain injuries. And what we are seeing from the research that colleagues have been doing, and for research around the world, looking at the injury rates and the risk, we are deeply concerned about the phenomenon of e-scooters, whether private or rental. For a number of reasons, such as the small wheels, the centre of gravity being right at the front, and the risk of riders being capitulated over the front of the handlebars if they hit a pothole or a drain cover, and the likelihood of them hitting their heads and suffering from these brain injuries. In addition, obviously, we support people with disabilities who and limited mobility or limited reaction time as a result of their brain injury. So from a pedestrian point of view as well, we are deeply concerned about this, and we feel that in its current state, the situation, I think, as Margaret used the phrase, is unacceptable. I think that we would echo that entirely and say that action needs to be taken to better protect all vulnerable road users, whether they're pedestrians or e-scooter riders. And I think by definition, e-scooter riders are very, very vulnerable.
Look, we could continue this panel, I think, for another 20 minutes at least. But in fairness to our other panelists, I'll have to thank you and move on. So, Ed, Luke, Tom, David, thank you ever so much, and I hope we'll continue to be in touch and share information as it emerges. So, thanks very much. And there are various questions in the chat. So, perhaps if you have got a moment, perhaps you could pick those up as relevant. Thank you.